Dr. Sass. I used to be an ER doc, and now I do primarily wellness medicine, family medicine, and of course bariatric medicine, weight loss medicine. I've been using ANS systems for quite a while now, and I find that the reports that they produce and the data that they give you is really essential, and we should be using it as a tool in probably 25 to 50% of the patients in your practice. Most of your patients suffer from some form of autonomic dysfunction. Most of them suffer from some form of an endothelial dysfunction, and some of them suffer from cardiometabolic disorders. And this machine can identify these disease processes very early, as well as give you data on the progression of how they do and where they go. There are a lot of machines on the market. I believe that all of them are very good. It's just the way that they represent the data that makes a difference. And I can tell you that the data that you get is, for example, on autonomic nervous dysfunction. And this really tells you about a difference between the parasympathetic and the sympathetic system. So for example, if they have a lot of sympathetic overdrive, then you know they're under a lot of stress, then you can deal with that. You can give them some techniques to improve stress, as well as possibly if they also have hypertension associated with stress, then you can deal with that differently than you would deal with somebody who has essential hypertension and essentially has a normal stress level. Another thing that a machine gives you is, for example, endothelial dysfunction, which tells you about the hardening of the arteries, as well as whether these patients need to have some kind of an intervention, be it a more aggressive cholesterol treatment, fish oil, weight loss, better diabetic control if they're diabetics or pre-diabetics. And endothelial dysfunction is identified very early by these machines. Another excellent variable that this machine gives you is cardiometabolic variability. And what that does basically is that it tells you if the patient is losing the cardiometabolic variability. And what I mean by that, so a normal heart should have very fine tuning of its rate. So if a patient is asked to stand up, take a deep breath, or do certain maneuvers like a Valsalva maneuver, the heart rate should modulate very well based on those different maneuvers that they make. If they lose that modulation and they get a very flat line, meaning that the heart rate doesn't really vary with all these actions that are asked from them, then they've lost this variability. And loss of variability is associated with a very high sudden cardiac death in the next year. So when you do see this loss of variability, then you know you have to get more aggressive, and you know that this patient should be sent out to more sophisticated testing, such as possibly a CT angiogram, a stress test with contrast, so on and so forth. These data is essential in being able to manage the overall patient, be the patient a diabetic, a hypertensive, or so on and so forth. The other great test that this machine tells you is it tells you different types of neuropathy, small fiber, large fiber neuropathy, and that is critical in finding patients who have, for example, small fiber neuropathy early and are diabetic. Then you know that those patients, you want to be more aggressive on a patient who's a diabetic and shows small fiber neuropathy than a patient who is a diabetic. Maybe their hemoglobin A1C is even worse, but they don't show neuropathy. And then you want to get to the basis of that neuropathy. Is it just related to the diabetes? Is it related to, do they have both diabetes and hypertension? Do they have lead poisoning? So on and so forth. This equipment, this ANS equipment, will be able to show you this neuropathy very early, and also you'll be able to monitor it over time. So for example, if you start a treatment, you can see as neuropathy is continuing to progress, or have you been able to stop the progression. And by being able to stop the progression, then you can at least stop the progression of the disease. And we all know the consequences of neuropathy and how bad that can be for the patient's future. The machine also gives you a whole bunch of what we call summary graphs, which are graphs based on different collection points of data that gives you a much better idea of where the patient is going. So it will give you, for example, a diabetic risk summary graph, a cardiac risk summary graph, and the machine will also give you lots of background data that you need for specific velocities, specific blood pressures, specific cardiometabolic graphs, for example. And those are useful for you to look at the raw data, as well it is required by the different agencies in order to be able to get reimbursed for this data correctly. If you don't have all those background information, then reimbursement can become a problem. But when you do have it, it's not an issue. For example, I've been doing it for a while, and I would say less than 5% of my claims are denied, and usually denied for other reasons not related to the test. I see some questions now?
That was awesome.